When people think this ends, it never ends.
It's a pain no parent should ever have to feel, the pain of losing a child.
I got a call at 4:18 on a Monday afternoon that she had leukemia, and it rocks your world because it wasn't what you were expecting.
But what happened next was really unexpected. It wasn't the leukemia that would take Carol Hemmelgarn's 9-year-old daughter Alyssa just 10 days later. It was a series of medical mistakes made by the staff at the hospital where Alyssa was treated.
So the people treating her thought she was anxious, and she wasn't. She had an infection that was elevated, where if you looked, her blood pressure was dropping. She needed oxygen, her pulse was increasing. She was cognitively not there anymore, but everyone thought she was just sleepy.
Carol's instincts were telling her otherwise, but she couldn't get anyone to listen until years later.
It was a journey because it took them 3 years, 7 months, and 28 days to have an honest conversation with me.
Still in grief, Carol told hospital administrators she actually wanted to help them.
All I ever wanted to do was know the truth, but I wanted to help you so that the other people walking through the front door of your organization, we learned from the mistakes and they weren't having to go through the same thing Alyssa did.
Carol shares her story now to help other hospitals, doctors, nursing groups, anyone that will listen.
In the field of patient safety, which is a passion of mine, there's a lot of medical errors. After Alyssa died, we were in a state of shock. You took your daughter into the hospital and you came home without her. And you walk in the house and you have to tell her brother, she's no longer alive. So at first it's like, all right, what happened?
Carol says she has seen changes for the better over the past 8 years.
Healthcare is changing. We're trying to break down the hierarchies where it's a team approach now.
And she says parents and loved ones need to make sure their voices are heard.
If your gut is telling you something is wrong, then you've got to articulate that and you've got to escalate it. Our loved ones, our children, they're not in a medical record. They're in the bed in front of us. Every parent, patient has a voice, and we have to learn to use our voice. We have to speak up when we think something isn't right or we don't understand. And we can't be afraid because we think we don't have the knowledge.
Alyssa passed away 8 years ago, but her mom, in her work to protect other patients, is making sure her memory stays alive.
She wouldn't let anyone else hurt.